Welcome to our weekly podcast called the 3-Minute Therapy Podcast. I'm here with my partner, Mick Berry, and we have a special guest today, Jill Levitt, and we'll all get a chance to introduce ourselves, and I'll do a little introducing. Also, I'm Dr. Michael Edelstein. I'm a clinical psychologist, and I've been trained in REBT, Rational Emotive Behavior Therapy, by Albert Ellis, who started a revolution in psychotherapy by changing the path of therapy from the more psychoanalytically oriented therapy to the cognitive behavior type therapy that is so popular these days. And Rational Emotive Behavior Therapy by Albert Ellis starts with the premise that our emotions come from our thinking about situations, not from situations themselves. And it comes from a particular type of thinking, and that's thinking in terms of demands. Must, should, supposed to's, have to's, demands we put on ourselves, others, and situations. I must do well and get approval, or else I'm no good. Life must go well, or it's no good, and others must treat me well, or else they're no good. So we teach clients to identify their irrational beliefs that cause their anxiety, depression, anger, procrastination, and addictions, and show them how they can question, challenge, contradict, and uproot those demands and reinforce the underlying preferences, which makes sense. Today, I am joined as usual with my partner, Mick Berry, REBT practitioner, who is starting a REBT meetup group. What's the name of that group, Mick?
San Francisco Rational Thinking and Behavior Meetup. How about
Fabulous.
that? I slipped in a lot of the words there because I'm not a therapist, but I slipped in enough of REBT to steal from it.
Great. So that's the REBT meetup group. And our special guest today is Jill Levitt, who is, could we say you're the director of the Cognitive Training Institute, Jill?
I am the director of training at the Feeling Good Institute. So we do have a director and a clinical director, and then I'm the director of training.
I see. And I assume it's called the Feeling Good Institute, named after David Byrne's book, Feeling Good?
Exactly.
Okay, great. So today we want to compare and contrast REBT and cognitive therapy. And I would say one of the main similarities is that in cognitive therapy, you also agree that it's our beliefs that cause our emotions, not situations. Is that correct?
Absolutely. Yes. I think we'll find there are far more similarities than differences, right? But yes. And by the way, I just wanted to say David Burns, who wrote the book Feeling Good and who's kind of inspired a lot of the work, the clinical work that we do and training as well, is a huge fan of Albert Ellis's and oftentimes talks about Ellis in his trainings as well. So again, yeah, so for sure the main tenet of cognitive therapy is the way that we think impacts the way that we feel.
Yes, and we interviewed, or at least I interviewed with an earlier partner, David Burns. We had 2 interviews with David Burns.
Oh, great.
So do either of you have any other thoughts about similarities between REBT and cognitive therapy, Mick?
Yeah, well, the main thing is, and this is what's most important, that our thinking and our emotions are interconnected, and people often think they can't change their emotions, but the way to change them is to change your thinking. And when we're thinking in self-defeating ways or feeling depressed, angry, or rageful, there's a distorted thought going on, or an irrational thought. And so we change the irrational thought and then we feel better. And one thing I've learned through REBT is that the irrational thought is unrealistic. The rational thought is realistic. I read Feeling Good, and that was what got me going on this path. And I found it pretty amazing. It's quite a book. And I found myself being happy. I was 27 at the time. I found myself being happy in ways that I didn't know I could be happy since the age of 12. I had a problem with depression off and on since the age of 12. And I was amazed about how I could feel so good. Now, I was going to mention a difference, if that's okay to mention that now, Michael.
Yeah, sure.
Yeah. The thing is, Jill, I found that nowhere in the, I only discovered this years later, but what happened to me was I was feeling so good, but then I started having anxiety about getting depressed, or anxiety about anxiety. And nowhere in the book did I find David Burns addressed the secondary disturbance, which is anxiety about anxiety, or depression about depression. And that is when things can really spin out of control, to where we become severely depressed because, oh God, I'm depressed. Oh no, I'm depressed. Oh, it's awful. Oh no, I'm depressed. And now I'm always going to be depressed, and I've always been depressed. And in any case, nowhere in the book was the secondary disturbance addressed. And I then found REBT, which addressed the secondary disturbance.
Yeah, and is that accurate interpretation, Jill, of cognitive behavior?
Actually, it's interesting. I wouldn't say that it's addressed as a secondary disturbance, but I would imagine, I mean, to me, that comes up all the time, and I address it all the time with patients. It's just that it's a secondary level of distorted thoughts, right? Like if one has the thought, oh no, I'm depressed, what they're really saying is, I shouldn't be depressed. And that's a cognitive distortion. And so that just, to me, that just goes right on their daily mood log as a new distorted thought, which is, I shouldn't be depressed. And then we would challenge, we would look at the distortions in that thought and challenge that with all sorts of cognitive therapy methods that we have. So it may be the case that it wasn't explicitly spelled out in that way, but I feel, of course, when I'm working with patients with anxiety about anxiety is about, is half the battle. Patients with panic disorder, for example, by definition are worried about the symptoms that they're having. And so for sure, those are things we address in cognitive therapy, but maybe not as explicitly or without that label, I think.
Yeah. Another, what seems to me to be a difference, and let me know if I understand cognitive behavior therapy accurately, is REBT is a philosophic kind of therapy, and that is, we look at the philosophies behind not only the cognitive distortions, but the philosophies behind what cognitive behavior therapy calls distortions. And the philosophy is in terms of musts and shoulds. And we say all musts and shoulds are fictions. There are no musts and shoulds. There's nothing you absolutely have to do except maybe die one day. But in terms of psychopathological musts and shoulds, they don't exist. They're all fictions. So we recommend our clients look at the world without demands, without musts and shoulds, just with preferences. Is that a difference, or does cognitive?
I would say, it's funny. I also think depends on who you're trained by and things like that. So I don't know about Beckian cognitive therapy as, specifically, but again, I do so much of my teaching and training with David Burns, who, was influenced by Belt Ellis. So we talk about that all the time when we talk about should statements. We say there are only a couple of things in the world that should happen. Like if I drop this pen, it should fall to the ground by the law of gravity, right? And there are laws that we should follow because otherwise we're, thrown in jail. But there's definitely no law that says people should treat you the way that you want to be treated. Right. And there's no law that says I should be smarter than I am, or I should always be a perfect mother. And so, again, I think, and perhaps it has its roots in REBT, but I spend a lot of time on the cognitive distortions with my patients, and should statements is only one of them, right? There's all or nothing thinking and overgeneralization and self-blame and, tons of cognitive distortions. So yeah, again, I think there's some overlap there too.
Yeah. Well, I was going to say this is another difference with REBT and cognitive therapy. In the book, David Burns lists, I believe, 10 cognitive distortions disqualifying the positive, mind reading. Should statements is one of them. Should statements is one of them. I have found that they really do all come down to a demand, a should, a must, a have to, that every cognitive distortion, every irrational thought is based upon a demand of something happening. I mean, mind reading of thinking people are thinking badly of me, that within that is the idea, I must not have people think badly of me. Now, the chances are slim that if I'm walking down the street, people are thinking badly of me. But even if they are, it isn't going to hurt me if they're just, I'm not working with them, that we have no affiliation. So I don't have to have people think well of me. So anyway, this was a big difference I noticed, because REBT says it's all about the demand, whereas cognitive therapy lists can, and they're very useful. I think that it's a wonderful book, and it's great that David has had so much success with it, because really, I don't know if I would have found the help that I needed, because I was very, very depressed for 15 years, since the age of 12. I mean, it would come and go, but I had a problem with it. And so the book was terrific. But I do think it could be improved upon in including the depression about depression, simply because I have found, and REBT says, this is the thing to really watch out for. Albert Ellis does say the craziest thought you can have is, I must not be irrational.
Right.
On,
Yeah. Sorry, I was just going to say one other thing, and then I'll turn it over to you. Is there's a big, and again, this is in my training with David Burns, and by the way, he has written a new book that's called Feeling Great, and so it does have a lot of changes and advancements to feeling good. But what I would say too, and I think this maybe is getting at a little bit of this being depressed about being depressed, is we address motivation a lot more now in this model of CBT. And one of the things that we do in addressing motivation is we call it positive reframing. And it's kind of looking at actually all of the benefits and positives of your, negative thoughts and feelings. And so to some extent, that might be saying that, like, when someone is feeling sad, maybe they're grieving, we say what's beautiful about your grief is that it shows how much you care about, this person or this thing that you've lost. And so we spend time actually trying to help people authentically feel sort of proud of their symptoms and understanding their symptoms and why they have them. And so I think in some way that also chips away at the concept of, like, shame about, right, you're saying, like feeling shamed about being depressed or thinking that I shouldn't be depressed. It's almost like, no, you should be, based on these different things. And of course, I mean, we don't mean that entirely, because we want to help people to feel better, but we do want to help people understand, what anxiety, how anxiety can be advantageous, and what it shows about what you care about and what you value. And I do think that helps kind of get away or chip away at the feelings about the feelings that you're referring to.
Yeah, Albert Ellis introduced that strategy with REBT, and he called it referenting, where you let the situation in your mind refer to some of the positives, not only the negatives. That's referencing. Another aspect of REBT, which is probably in CBT, but not as emphasized as much as REBT, is unconditional self-acceptance. So we teach clients, whether they do well or poorly, or people like them or dislike them, They're always imperfect humans who act imperfectly.
Yep.
And that's the most accurate statement about their worth. So there's no worthwhile people or worthless people, good people or bad people. There are just us imperfect humans who act imperfectly. Mick?
Yeah, and I was just going to say, I do an REBT exercise every morning to stay mentally healthy, and I gauge my lack of mental disturbance or my mental disturbance on falling into one of three categories. Am I not unconditionally accepting myself, or unconditionally accepting the world, or unconditionally accepting other people? Because everything will fall within one of those three categories. And so I begin there and I can see, oh, I didn't do well last night at the performance I was given. And so I'm thinking badly of myself rather than badly of the performance. And along those lines of accepting myself unconditionally, it's pretty easy to do if I just remember there's something called the past and there's something called the future, so that I don't become arrogant. No matter how many great things I've done, I can always mess up in the future. And no matter how many bad things I've done, I can always do better in the future.
Very good.
Yeah.
Jill, there are two other points I want to ask you about before we conclude. One is in terms of helpful negative emotions. So in REBT, we don't say all negative emotions are bad. There are appropriate adaptive negative emotions, like feeling frustrated when your goals are blocked, or disappointed or displeased. And there are unhelpful negative emotions such as anxiety, depression, and anger. So does CBT have an equivalent to that?
Yeah, absolutely. And I would actually say anxiety is sometimes helpful, right? I mean, if I'm walking down a street at night in the dark and I hear, the sounds of footsteps behind me, being anxious and checking my way, or jogging if someone's threatening, is helpful. So right, is adaptive. I mean, there's maladaptive and adaptive emotions. And I would say it has more to do with the function they serve and the intensity than the name of them. But yeah, and the way that it comes out in CBT and the way that I practice it is actually that we use something called the daily mood log, or a thought record, or whatever you want to call it. And we have patients actually circle the feelings that are coming up for them. Let's say they have a negative event occur, or they have a test that's coming up, and then they have a whole range of negative emotions. And we have them rate those emotions, and then we have them write down their thoughts that are driving those emotions. And then the question is, actually, we ask a question that's, if you could kind of dial that emotion down to just the right level, right, where it was working for you, but not hurting you. And so that's how we kind of honor that idea, right? And it isn't the fact, I don't have a tool that's actually going to help people dial their emotion down to, 70%, or in most cases, 10%. But the idea is more that you're instilling in people the concept that it's not the emotion at all that's a problem, but it's the emotion at the degree that you're experiencing it, right, that's getting in your way, or it's your distorted thoughts that are driving those emotions, right? So
maybe here's where we come to a substantive difference, because in REBT, we see all anxiety as unhelpful, inappropriate, because if it's a little anxiety, it comes from a little must. And as we agreed earlier, all musts are fictions. There's nothing that has to be. So an appropriate negative emotion would be great concern, or on a dark street, vigilance, or but not any level of anxiety. Mick?
Yeah, I was going to say, I can give you a tool, Jill, and the tool would be finding the demand. Now, one thing I've learned, it's tricky, because the more we want something, the easier it is to turn it into a demand, and it's only human to do so. And I still do that myself. And some people, I've heard people in Buddhism say, well, give up all worldly desires. I think that's ridiculous. Keep your desires, get rid of your demands, but it takes practice. As Ellis would say, practice, practice, practice. Because the more we want something, the easier it is to turn it into a demand. But that doesn't mean we can't gain the skill. We can gain the skill to keep our really passionate desires as passionate desires and not turn them into demands.
Absolutely.
Yeah.
And there are, I just wanted
fun-
to add, I mean, there are, when you talked about the exercises that you do in the mornings, Mick, you know, there are a lot of cognitive therapy exercises that overlap with lots of those things. Like we use the method that's called Be Specific. And it is basically this idea, like if I snapped at my kid in the morning and I said, I'm a terrible mother, right? That's an overgeneralization and a label. And again, as you would say, it's a demand, like I should be a perfect mother. Or maybe you have a different way of wording it. And then we use the word be specific, which is like, I can just describe the occurrence without any of the distortions. Like, you know, when I'm pressed for time, I sometimes snap at my child, and maybe that's something that I want to work on, but I don't then need the label, I'm a terrible mother, in order to be motivated to work on it.
And
So you know, there are other methods, shades of gray, and we have a method that's called best, worst, average, which again is very similar to this idea that I'm this way at my best, I'm this way at my worst, I'm this way on average, but I am not, you know, a terrible person or an impatient person, right?
Right, right. And then finally on the gradation idea, I think another substantive difference is we see all anger is inappropriate because, as Mick was saying, look for the must, and with any anger, there's a must, and that is you must treat me better, you must not criticize me, those things. So even a little anger is inappropriate because it comes from a little must, but it's still a must. Does that make sense, Jill?
Yeah, no, that is a difference for sure. Because we would say, again, I kind of would say, like, if you had a dial and you could dial that anger to kind of just the right level where you could hang on to your, let's say, self-respect or your standards, or, you know, like, where would you want that to be? And again, I kind of leave that up to the patient. Like I'm saying, well, when it's too high, obviously it gets in your way and it interferes in your relationships and you're cranky. But, you know, is there a level where you feel like you can kind of hang on to, right, like some of those expectations, and at the same time not be suffering as much? And so, yeah, I would agree that is a difference.
Yeah, Mick?
And I just thought of a similarity, a big similarity, which I think is highly important and really rests on health rests upon it, which is semantic precision.
Yeah.
Because if we're being semantically precise, which means realistic and accurate, then we will steer ourselves away from disturbing ourselves and self-defeating feelings and behavior.
And I have a question for you guys, which is my understanding of REBT, and it may be like an old school, old wives' tale, or it may be totally true, but is that therapists and REBT are more sort of aggressive and, you know, kind of in your face, and you know, whereas with CBT, actually, I would say that I'm very direct, and I'm very, you know, I'm not letting my patients BS or pretending they're different than they are, but there's a lot of empathy woven into the work that I do. And I suspect you guys are also quite empathic, but I'm curious what your spin on that is. Are you like telling your patients this is the way it is and this is the way it's meant to be, you know, or do you feel like there is a more collaborative like spirit to REBT?
Yeah, well, I think that's an old wives' tale, or not to be sexist, an old husband's tale also.
Fair enough. Thank you.
Yeah. And one of the main things we teach clients is to ask, what is the evidence? So it's up to them to look for evidence rather than the therapist telling them there's no must, there's no shoulds, things like that, but rather having them look for the evidence. What is the evidence that you have to do what you want to do? Or where is the evidence that people must treat you the way you want? And in the A, B, C, D, E, F, D is disputing or asking, what is the evidence for my irrational belief, for my must or my should? Does that answer that, Jill?
Yeah, that it is more collaborative. We do exactly the same thing. We're asking the patients, what are the distortions in your thoughts? Like, I want you to identify the distortions. We do examine the evidence as well. So yeah, you feel like it is more collaborative and less bossy than its reputation.
Mick, if you could take just a few seconds to say what you want
Yeah,
to say.
yeah. Well,
We're up against the clock here.
yeah, my main experience is giving myself the therapy. And I am very hard nosed with myself. And so I'll be very forceful, very passionate, and very not to demand myself to give up the irrational thought, but I'll just tell myself, come on, pal, is that true? It's not true. It's ridiculous to believe it. Throw it out. You'll feel a lot better. Now I'll use profanity in there because it's inspired by Albert Ellis, who, of course, let the profanity fly. But in any case, my main experience is with myself, in which I'm rigorous and I do follow Albert Ellis's advice: push your ass.
Yeah, and Jill, to answer your question, it's really up to the style of the therapist. It's
Right.
not necessary to REBT to be more confrontative or less confrontative, more passionate like Mick is or less passionate, but mainly to teach them the theory, the approach, and how to apply it. Well,
Yeah.
we had a very informative session here. I learned some new things about cognitive behavior therapy. So thank you, Jill, for joining us. Jill Levitt, the Director of Training of the Cognitive Therapy Institute. Mick Berry, my partner in crime here. And I'm Dr. Michael Edelstein, clinical psychologist. If you had any thoughts about this interview, please comment below. Give us a thumbs up if you enjoyed it. Suggest subjects for future podcasts. Volunteer if you'd like to be a guest on our interview and podcast. Looks like Jill survived very nicely. And
I highly recommend it.
and subscribe to the 3 Minute Therapy podcast to stay on the rational side of life.